Hi, everyone. This is Nurse Anna from nursestudy.net, and here are 25 questions with answers and rationales regarding cardiac arrhythmias. I hope you enjoy this one. Let me know in the comments below. Before I forget, I do have free audiobooks via A6 Audible. All you need to do is look at the link in the description, and it's a free 30-day trial. You can get through the book within the 30 days. So please utilize this to get more questions for NCLEX NGN that you can listen to in your car or in the library.
Question 1. A 65-year-old male patient with a history of atrial fibrillation presents to the emergency department complaining of dizziness and palpitations. His heart rate is irregular, and an ECG shows atrial fibrillation with a ventricular rate of 130. Which of the following interventions should the nurse anticipate the healthcare provider will order to stabilize the patient? A. Vagal maneuvers. B. Beta blockers. C. Adenosine. D. Anticoagulants. Answer: B. Beta blockers. Rationale: in cases of atrial fibrillation with rapid ventricular response, beta blockers, such as metoprolol, are commonly used to control the heart rate. Vagal maneuvers are not effective in atrial fibrillation. Adenosine is used for paroxysmal supraventricular tachycardia, not atrial fibrillation. Anticoagulants are used to prevent thromboembolism but do not directly manage the acute rate control. Question 2. A 58-year-old female patient is admitted to the cardiac unit after experiencing a sudden onset of palpitations and shortness of breath. The ECG reveals a ventricular rate of 180 with wide QRS complexes. The nurse suspects ventricular tachycardia. What should the nurse anticipate as the priority intervention? A. Synchronized cardioversion. B. Defibrillation. C. Epinephrine administration. D. Amiodarone infusion. Answer: A. Synchronized cardioversion. Rationale: synchronized cardioversion is indicated for patients with ventricular tachycardia who are hemodynamically unstable but still have a pulse. Defibrillation is used for pulseless ventricular tachycardia or ventricular fibrillation. Epinephrine is not the first-line treatment for ventricular tachycardia with a pulse, and amiodarone may be used after cardioversion or if the patient is stable. Question 3. A patient with a known history of atrial fibrillation presents to the clinic for follow-up. The patient is not currently on any anticoagulation therapy and has been experiencing intermittent episodes of chest pain and dyspnea. The nurse recognizes the patient is at risk for which of the following complications? A. Myocardial infarction. B. Deep vein thrombosis. C. Pulmonary embolism. D. Stroke. Answer: D. Stroke. Rationale: atrial fibrillation increases the risk of thrombus formation in the atria, which can embolize to the brain, causing a stroke. While deep vein thrombosis and pulmonary embolism are also thromboembolic events, they are less directly related to atrial fibrillation. Myocardial infarction can occur, but stroke is the most common complication associated with untreated atrial fibrillation. Question 4. A patient in the intensive care unit suddenly develops an irregular heart rate and the monitor shows a polymorphic ventricular arrhythmia consistent with Torsades de Pointes. The nurse should prepare to administer which of the following medications? A. Magnesium sulfate. B. Atropine. C. Lidocaine. D. Dopamine. Answer: A. Magnesium sulfate. Rationale: Torsades de Pointes is a specific type of ventricular tachycardia often associated with prolonged QT intervals. Magnesium sulfate is the drug of choice for this arrhythmia. Atropine is used for bradycardia, lidocaine is used for ventricular arrhythmias, but not torsades specifically, and dopamine is used for hypotension, not arrhythmia management. Question 5. A 72-year-old patient with a history of congestive heart failure is on digoxin therapy and presents with complaints of nausea, dizziness, and visual disturbances. The nurse notes a heart rate of 50. Which of the following arrhythmias is the patient most likely experiencing? A. Atrial flutter. B. Sinus bradycardia. C. Junctional rhythm. D. Atrial fibrillation. Answer B. Sinus bradycardia. Rationale: the symptoms of nausea, dizziness, and visual disturbances are classic signs of digoxin toxicity, which can lead to sinus bradycardia. Atrial flutter and fibrillation would present with irregular rhythms, and junctional rhythms typically have a rate between 40 and 60 beats per minute, but are not typically caused by digoxin toxicity. Question 6. A nurse is caring for a 45-year-old patient who has developed a third-degree heart block. The patient is hemodynamically unstable, with a heart rate of 30. Which intervention should the nurse anticipate? A. Intravenous calcium gluconate. B. Temporary transcutaneous pacing. C. Adenosine. D. Electrical defibrillation. Answer B. Temporary transcutaneous pacing. Rationale: third-degree heart block, also known as complete heart block, requires immediate intervention, typically with temporary transcutaneous pacing if the patient is hemodynamically unstable. Adenosine is used for supraventricular tachycardias, not heart block. Calcium gluconate is used in cases of hyperkalemia, not heart block. Defibrillation is used for ventricular fibrillation or pulseless ventricular tachycardia, not heart block. Question 7. A patient presents to the emergency room with chest pain, nausea, and shortness of breath. The ECG reveals ST segment elevation in leads V1 to V4. Shortly after, the patient develops ventricular fibrillation. What is the priority action the nurse should take? A. Administer IV amiodarone. B. Administer supplemental oxygen. C. Initiate CPR and defibrillation. D. Administer IV epinephrine. Answer C. Initiate CPR and defibrillation. Rationale: ventricular fibrillation is a life-threatening arrhythmia that requires immediate defibrillation and CPR as the priority intervention. Amiodarone and epinephrine may be administered if the defibrillation fails to restore a normal rhythm, but CPR and defibrillation are the priority. Question 8. A 55-year-old male with a history of ischemic cardiomyopathy presents with palpitations and an ECG showing monomorphic ventricular tachycardia at a rate of 160. The patient is alert but complains of dizziness and lightheadedness. What is the most appropriate action by the nurse? A. Administer IV lidocaine. B. Prepare for synchronized cardioversion. C. Administer IV adenosine. D. Administer IV digoxin. Answer B. Prepare for synchronized cardioversion. Rationale: in the case of a hemodynamically unstable ventricular tachycardia with a pulse, synchronized cardioversion is the recommended intervention. Lidocaine may be used if the patient remains stable. Adenosine is ineffective for ventricular tachycardia, and digoxin is not used in acute management of ventricular tachycardia. Question 9. A patient with chronic atrial fibrillation is being discharged with a prescription for warfarin. The nurse is providing discharge teaching. Which statement by the patient indicates the need for further teaching? A. I will have my INR checked regularly to adjust my dose. B. I need to eat more green leafy vegetables to improve my health. C. I will report any signs of bleeding, such as bruising or black stools. D. I should avoid contact sports to reduce my risk of injury. Answer B. I need to eat more green leafy vegetables to improve my health. Rationale: warfarin interacts with vitamin K, which is found in green leafy vegetables. Increasing intake of these vegetables can interfere with the effectiveness of warfarin, leading to an increased risk of clot formation. The other statements are correct and indicate appropriate understanding of warfarin management. Question 10. A 48-year-old patient is admitted with a diagnosis of hypertrophic cardiomyopathy and is experiencing episodes of ventricular tachycardia. The nurse anticipates the healthcare provider will order which of the following medications to reduce the risk of sudden cardiac death. A. Atropine. B. Beta blockers. C. Norepinephrine. D. Calcium channel blockers. Answer B. Beta blockers. Rationale: Beta blockers, such as metoprolol, are commonly used in hypertrophic cardiomyopathy to reduce the risk of arrhythmias and sudden cardiac death by decreasing the heart rate and improving diastolic filling. Atropine is used for bradycardia, norepinephrine for hypotension, and calcium channel blockers may help in some cases but are not typically first line for arrhythmia control. Question 11. A patient with a history of myocardial infarction suddenly collapses. The ECG monitor shows ventricular fibrillation. The nurse knows the priority action is to A. Administer epinephrine. B. Perform a precordial thump. C. Begin chest compressions and defibrillation. D. Administer amiodarone. Answer: C. Begin chest compressions and defibrillation. Rationale: ventricular fibrillation is a life-threatening arrhythmia that requires immediate defibrillation and chest compressions. Epinephrine and amiodarone are used after defibrillation if necessary. The precordial thump is no longer recommended for routine use and is considered an outdated practice. Question 12. A patient with a heart rate of 38 is experiencing dizziness and hypotension. The ECG reveals third-degree heart block. What is the most appropriate action by the nurse? A. Prepare the patient for temporary transcutaneous pacing. B. Administer atropine. C. Administer a beta blocker. D. Perform a vagal maneuver. Answer: A. Prepare the patient for temporary transcutaneous pacing. Rationale: third-degree heart block requires immediate intervention with transcutaneous pacing, especially if the patient is symptomatic with hypotension and bradycardia. Atropine may be ineffective in third-degree heart block. Beta blockers would further slow the heart rate, and vagal maneuvers are contraindicated in this situation. Question 13. A 62-year-old patient is diagnosed with atrial flutter and is scheduled for an elective cardioversion. What is the nurse's priority action before the procedure? A. Ensure the patient has been NPO for 8 hours. B. Administer anticoagulant therapy as prescribed. C. Perform a 12-lead ECG. D. Administer IV sedation. Answer: B. Administer anticoagulant therapy as prescribed. Rationale: in atrial flutter, anticoagulation is essential before elective cardioversion to prevent thromboembolic events. Ensuring the patient is NPO and administering IV sedation are also important but are secondary to anticoagulation. A 12-lead ECG may be performed before the procedure but is not the priority. Question 14. A 70-year-old patient presents with bradycardia, hypotension, and syncope. The ECG shows sinus bradycardia with a rate of 30. What is the first-line treatment the nurse should anticipate? A. Adenosine. B. Atropine. C. Magnesium sulfate. D. Defibrillation. Answer: B. Atropine. Rationale: atropine is the first-line treatment for symptomatic bradycardia. It works by increasing the heart rate. Adenosine is used for supraventricular tachycardia, magnesium sulfate is used for torsades de pointes, and defibrillation is used for life-threatening arrhythmias like ventricular fibrillation. Question 15. A patient with long QT syndrome is admitted to the emergency department after a syncopal episode. The nurse monitors the patient for the development of which of the following life-threatening arrhythmias? A. Ventricular fibrillation. B. Supraventricular tachycardia. C. Atrial flutter. D. Torsades de pointes. Answer: D. Torsades de pointes. Rationale: long QT syndrome increases the risk of developing torsades de pointes, a polymorphic ventricular tachycardia that can lead to sudden cardiac death. Ventricular fibrillation is also life-threatening but is not directly associated with long QT syndrome. Supraventricular tachycardia and atrial flutter are not typically complications of long QT syndrome. Question 16. A 58-year-old patient with dilated cardiomyopathy is being monitored in the ICU. The nurse notes an episode of ventricular tachycardia on the monitor, but the patient remains stable. What is the next action the nurse should anticipate? A. Administer a beta blocker. B. Perform synchronized cardioversion. C. Administer IV amiodarone. D. Prepare for defibrillation. Answer: C. Administer IV amiodarone. Rationale: for stable ventricular tachycardia, the first-line treatment is often an antiarrhythmic medication, such as amiodarone. Synchronized cardioversion would be used if the patient becomes unstable. Defibrillation is used for pulseless ventricular tachycardia or ventricular fibrillation. Beta blockers are not typically used in acute management of ventricular tachycardia. Question 17. A patient with atrial fibrillation has been prescribed dabigatran. During discharge teaching, the nurse explains that the patient should avoid which of the following? A. Grapefruit juice. B. Green leafy vegetables. C. Nonsteroidal anti-inflammatory drugs, NSAIDs. D. Dairy products. Answer: C. Nonsteroidal anti-inflammatory drugs, NSAIDs. Rationale: NSAIDs increase the risk of bleeding, which can be dangerous for patients on anticoagulants like dabigatran. Grapefruit juice and dairy products do not have significant interactions with dabigatran, and green leafy vegetables primarily affect warfarin, not dabigatran. Question 18. A patient with a history of coronary artery disease and a recent myocardial infarction presents with chest pain and shortness of breath. The ECG reveals frequent premature ventricular contractions, PVCs. The nurse should anticipate which of the following interventions? A. Administer IV adenosine. B. Administer IV amiodarone. C. Administer sublingual nitroglycerin. D. Perform synchronized cardioversion. Answer: B. Administer IV amiodarone. Rationale: amiodarone is commonly used to treat frequent PVCs, especially in patients with a history of myocardial infarction, as it helps stabilize the ventricular rhythm. Adenosine is used for supraventricular tachycardias, and nitroglycerin is used for chest pain associated with ischemia. Cardioversion is not indicated for PVCs. Question 19. A 45-year-old patient presents with syncope, and the ECG reveals an abnormal, prolonged QT interval. The nurse recognizes that the patient is at risk for which arrhythmia? A. Ventricular fibrillation. B. Atrial fibrillation. C. Atrioventricular block. D. Torsades de pointes. Answer: D. Torsades de pointes. Rationale: a prolonged QT interval increases the risk of torsades de pointes, a type of polymorphic ventricular tachycardia. Atrial fibrillation and atrioventricular block are not directly related to QT prolongation, and while ventricular fibrillation is a life-threatening arrhythmia, it is not the primary concern with prolonged QT. Question 20. A patient is experiencing paroxysmal supraventricular tachycardia with a heart rate of 180. The nurse prepares to administer which medication to convert the rhythm? A. Amiodarone. B. Adenosine. C. Atropine. D. Digoxin. Answer: B. Adenosine. Rationale: adenosine is the first-line drug for treating paroxysmal supraventricular tachycardia as it works quickly to interrupt the re-entry pathways causing the tachycardia. Amiodarone is used for ventricular arrhythmias, atropine for bradycardia, and digoxin is not first-line for acute PSVT management. Question 21. A patient presents to the emergency department with chest pain and shortness of breath. The ECG shows atrial fibrillation with a rapid ventricular rate of 140. Which intervention should the nurse anticipate to control the patient's heart rate? A. Administer IV calcium gluconate. B. Administer IV beta blockers. C. Administer IV adenosine. D. Perform defibrillation. Answer: B. Administer IV beta blockers. Rationale: IV beta blockers, such as metoprolol, are commonly used to control the heart rate in atrial fibrillation with a rapid ventricular response. Adenosine is used for PSVT, calcium gluconate is used in hyperkalemia, and defibrillation is not indicated unless the patient is hemodynamically unstable. Question 22. A patient is experiencing symptomatic bradycardia with a heart rate of 35. The nurse prepares to administer which medication as the first-line treatment? A. Epinephrine. B. Atropine. C. Amiodarone. D. Dopamine. Answer: B. Atropine. Rationale: atropine is the first-line medication for treating symptomatic bradycardia as it increases the heart rate by blocking the effects of the vagus nerve. Epinephrine and dopamine are used if atropine is ineffective. Amiodarone is used for ventricular arrhythmias, not bradycardia. Question 23. A patient with a known history of long QT syndrome is admitted after experiencing a syncopal episode. The nurse understands that which of the following electrolyte imbalances should be corrected to prevent arrhythmias? A. Hypernatremia. B. Hypermagnesemia. C. Hypocalcemia. D. Hypokalemia. Answer: D. Hypokalemia. Rationale: hypokalemia is associated with a higher risk of developing life-threatening arrhythmias such as torsades de pointes, particularly in patients with long QT syndrome. Correcting electrolyte imbalances, especially potassium and magnesium, is essential to prevent arrhythmias. Hypernatremia and hypermagnesemia are less commonly associated with arrhythmias, and hypocalcemia is not typically a concern in this context. Question 24. A patient with a history of heart failure presents with new-onset atrial fibrillation. The nurse understands that the patient is at increased risk for which of the following complications? A. Myocardial infarction. B. Deep vein thrombosis. C. Pulmonary embolism. D. Thromboembolic stroke. Answer: D. Thromboembolic stroke. Rationale: atrial fibrillation increases the risk of thrombus formation in the atria, which can embolize and cause a stroke. Deep vein thrombosis and pulmonary embolism are also thromboembolic events, but are not directly caused by atrial fibrillation. Myocardial infarction is possible in heart failure, but is not the primary complication of atrial fibrillation. Question 25. A patient presents to the emergency department with palpitations and lightheadedness. The ECG shows a narrow complex tachycardia at a rate of 180. The nurse applies vagal maneuvers, but the patient's rhythm does not convert. What is the next action the nurse should anticipate? A. Administer IV adenosine. B. Perform synchronized cardioversion. C. Administer IV amiodarone. D. Administer IV digoxin. Answer: A. Administer IV adenosine. Rationale: adenosine is the next step in managing paroxysmal supraventricular tachycardia, PSVT, if vagal maneuvers fail. Synchronized cardioversion is used if the patient becomes unstable or if adenosine is ineffective. Amiodarone is used for ventricular arrhythmias, and digoxin is not the first-line treatment for acute PSVT.